Okay, everyone, I think everyone's slowly coming in, so we will begin today. Just allowing everyone to be admitted. Great. So I'm sure there'll be a few more stragglers, but we'll get started with the view of not running too late this evening, keeping you for too long. So welcome to our now actually by sort of monthly, but nonetheless monthly webinar that we host in different capacities. Today, the webinar is focused around the concept of can you really do both? Because it's a recurring question. Can I work in the NHS and have a career? And can I actually be a success in aesthetic medicine? Can I do both? Should I do both? How do I do both? And we are living proof that you absolutely can do both. And so we'd like to talk about it today. So I'm going to give you a brief overview of what we're going to discuss. But just before I do, there's a few things. Housekeeping is we request that you put yourselves on mute if that's okay, but we really do like it when videos are on. If you don't mind, we don't mind if you're in your pajamas or at work or not at work. It's nice not to speak to blank screens the whole time, so we're here interacting with you. We'd love you to do the same. In addition to that, we'd really like you to put in the chat box who you are, maybe your name, where you're from, in which part of the country, and if you've done any training in aesthetic medicine, set up your clinic, not done anything before. It's because it makes it interactive, it makes us understand who you are, where you're coming from, and perhaps your profession. If you're a doctor, dentist, nurse, pharmacist, and just to explain a bit about that in regards to the chat box, popping it in there and being interactive, because on the call we have a number of brand ambassadors, a number of the acquisition aesthetics team, and lots of people who will continue to interact with you. So the last housekeeping thing is any questions, put them in there as we go along into the chat box. So start entering your credentials, saying hello to us in the chat box. Please put your questions as we go along. We'll have a Q&A session at the end, but it invariably ends up being overloaded and we run out of time. So we'd be grateful if you pop it in there now. So here's the outline of the webinar. We want you to understand how to make aesthetics work with your NHS practice. It is completely possible. We want to teach you how as best as we can in the hour. We want you to understand and have realistic expectations from what you can really expect from your first injection or your first treatments, how to deliver them safely, successfully with happy, satisfied patients. We'll be taking you through, and I will be in particular, a full face demonstration. I'll be talking about the anatomy, talking about how I injected the face, the results that I achieve, and what you can expect to also achieve as you progress in the aesthetics arena. And then, of course, you have to understand the market opportunities, the business opportunities, and the regulations. It's important. It's a CPD verified webinar. You'll receive your certificate at the end, and it can be included in your professional portfolio. The very last thing I'll say is, apart from the first few slides, there's a lot of writing. Ignore it and just listen to me if you can. But we know that some people do like more writing on the slides than others, and so it's included, but just make sure you listen to me. So first and foremost, it's a bit about who we are and why we are incredibly unique. So Acquisition Aesthetics has been founded by two female plastic and maxillofacial surgeons, and that is myself and Lara. So I'm Priya. I am a consultant plastic surgeon at Guy's and St Thomas's Hospital and also Woolwich Hospital Trust. I have a very large clinic in Kensington. It's a 10-person clinic. I'm a global speaker and educator for many manufacturing brands, and of course one of the co-founders of Acquisition Aesthetics. So it tells you, yes, you can be at one of the leading London hospitals in NHS practice and have a successful aesthetics business. There's no doubt about it. Lara is a senior registrar on the Oxford Deanery in the maxillofacial arena. So she's dual qualified as a doctor and dentist, specialist interests in anatomy in particular, a real passion for that, in basic science and research and publishing, data and evidence, and also a speaker globally for educating in aesthetic medicine. However, behind us is a phenomenal, ever-growing, wonderful team of injectors, brand ambassadors, team members, model coordinators, patient coordinators, just a phenomenal team. They exist dotted around over 120 of them throughout the country, because we run courses throughout the country, predominantly London focused, but nonetheless centres in Newcastle, Manchester, and many other places. And actually, they are there to not only make everything run smoothly, ensure that you inject on live patients, ensure that courses run seamlessly, the back-end learning is updated, but they are there as your community to access at any point, any time. We are really proud to be one of the only academies, truly, that you can access 365 days a year should you have any questions, concerns, problems. And that is something we absolutely didn't have during our training. It's invaluable. So here come the busy slides. In terms of what make us unique, there are a phenomenal amount of things that I've already said, but we are to date one of the only academies in the UK and otherwise led by female surgeons, led by surgeons full stop. We are also one of the only academies that have the NHS component and also the private practice component in regards to aesthetic medicine. That has not been easy to juggle with the children that we also have, the directors between them. We have 5 children at one point under the age of 5. So we've done whatever you might be ambitiously hoping to do, and we have great advice to give on that. Our faculty is made up proudly of doctors, dentists, nurses, and surgeons. We really realized very early that a multidisciplinary approach to it was essential, because actually when I was teaching on the anatomy sections, I realized that the dental relationship of the teeth was so important and I couldn't articulate or teach that appropriately. So we had to bring in some brilliant dentists that we had, or maxillofacial surgeons, and offering those components to the teaching was essential. And similarly from the nursing side as well. So we know that we have a faculty that spans the breadth of wherever you might be coming from. We really pride ourselves on small group teaching. When you're learning, you have to learn on live patient. It's essential. You have to learn with brilliant products so that you can learn what you're going to use in your clinic. We don't just use cheap products on our courses and then wish you all the best. That's not the way it's done. And the small group teaching is very close in particular to my heart. My entire master's was on the acquisition of skill and the optimum size group for learning. And actually it's been shown one-to-one is brilliant, of course, but when you're learning in numbers of 3 or 4 within a group of a similar standard to you, you often have a faster rate of knowledge acquisition than you would if you learnt as a one-to-one, because you learn from your peers, you learn from the questions they're asking, and it's essentially ignites different cortices in your brain to start thinking laterally and differently. So it's really important. As mentioned, it'll be real patients. You'll have a huge network and community afterwards. The resources are invaluable. Our video library is ever extending. We've just added 20 more videos to it with anatomy, the injecting. We take you through step by step. And actually we have brilliant industry links after you finish. So once you're done, one of the things that we found was we literally finished our course and we didn't even know where to start. We didn't even know how to prescribe it or where to get it from, whatever it was. Maybe it was toxin, maybe it was fillers, maybe it was something else. It was really interesting. We just kind of hit this roadblock. So we've tried to break down all the roadblocks you might hit. We've done your industry links with the very best. We've got you your industry discounts. We've got your continued CPD. And actually we make that pathway seamless for you. So the only thing you have to worry about and be concerned about is your actual treatments you give your patients, and your full focus can go on it. And of course, we practice very heavily, and many don't in the UK in particular because it's unregulated. Lara will talk a bit more about it, but we practice evidence-based medicine. So not only are you practicing the most innovative evidence-based data sets in terms of the treatments you're offering, but actually you're practicing medicine that is very defendable should it need to be, because you are following the evidence. We publish regularly. We publish in many journals. I think we did 9 publications last year. We've got 4 or 5 in process at the moment, and we head up and run international clinical trials as well. So it's really important that we keep up to date. And of course, this is the question: can you really do both? And I want you to know, 10 years ago, we were asking ourselves the same question. We said we were a jack of all trades and a master of none. We used to really beat ourselves up about it. And actually, if we're really talking bluntly, we had other training providers completely publicly and otherwise bringing us down for doing both, saying, well, you're in neither camp. You're trying to do training and you're also trying to do this. And actually, you're doing neither. And it turned out, as many women do, and men, but as many women do, we multitasked and we did it bloody well. So not only did I rank #1 in the country for the registrar applications and got one of the best jobs in the country at Guy's and St Thomas's, but also our aesthetic clinics, our academy have thrived. And so we are proof that with a community and multitasking, let's say, and organizational skills, you can absolutely do both. And so the question isn't, should I quit the NHS? Should I do both? The question is, how do I do both? Empower me, and how do I do both really well? That's the question, truly. It's not, can I do both anymore? And we're not the only two. In many, many, many years past, now there are hundreds of clinicians doing both that have brilliant careers in both. There's synergies between being in the NHS, keeping grounded, learning treatments anatomy from that perspective, and actually working privately in aesthetic medicine. And really, many practitioners are only doing 1, maybe 2 evenings, not full days a week. And whilst you're getting started, it's brilliant to be able to do both. And so this is really an interesting slide from my perspective, because essentially you always need to ask yourself why you're bothering. Okay, so yes, there might be a vague interest that you have, or you've seen it, especially with the social media coverage in regards to aesthetic medicine, but something in you's been sparked. It's an interest potentially, but there will be something more. And I bet you it exists on that wheel. It'll be something about your job satisfaction you're not getting fully, or autonomy of your working hours, or maybe you've had kids and suddenly you're being asked to do overnight shifts or weekends, or quite frankly, you're just not remunerated and paid enough. And that's also an acceptable conclusion to make. Many of us have made it. But there will be something intriguing about the career in aesthetic medicine that you want to explore further. And I'd hedge my bets that's probably why you're here this evening. So I want to talk frankly about money, because it's often skirted around. It's a relatively British thing to do, and who pays the bill and who skirts around money, but we don't really in aesthetic medicine. And it's important that you see data. So here is some data from solo practitioners in red as a beginner, experienced and successful, or premium. Solo practitioner versus clinic owner, so a bit larger. Here are the figures that you can realistically look to achieve. And I'm going to start only with beginner and small, because that's probably where you're starting. And actually, as a solo practitioner, as a self-employed beginner level, you can look to make between £30,000 and £60,000 per year. Now, we've been in this for 14 years, and it was in our 3rd year 14 years ago, when nobody even talked about the concept of having anti-wrinkle injections, that we achieved those numbers. And so this data is on many of our graduates and what you can achieve. And when you look to open a clinic, even if it's a small clinic, so let's say you add 1, maybe 2 people to your clinic, you can look to increase your earnings as a small clinic between £80,000 and £150,000 per year. So yes, the financial freedom is certainly present, which features on this wheel, but there will also be other things that resonate with you in terms of deciding why this might be a career for you. And actually, standing out isn't as hard as you think. I must confess, this is probably the most asked question now. It wasn't. And it's, in a saturated market, don't you think there are enough practitioners? And they mean particularly in London. I get asked it a lot. We've just done a couple of trade exhibitions and shows with the dentistry show and CCR where we were speaking. And it was my most frequently asked question by far. And the answer is very simple. It is indeed perceived to be a saturated market. It's every second flick on Instagram and every second shot, but it's not saturated with the right people that the public are now seeking out for treatment. It's not saturated with healthcare practitioners such as yourself, because you have to have a verified PIN with a responsible body to even attend this webinar. And actually, those people are now being looked for, sought out by the public, because the awareness around unsafe treatment, unsafe practice has come to the forefront. So yes, it appears to be saturated, but with the wrong people. And actually standing out is far easier than you think, because the industry is growing and it shows no signs of shrinking. It is one of the most rapidly growing industries across all of them in the UK and globally, not just in the beauty sector. It's actually growing at around 10 to 12% a year. And there are not many industries in any sector, including tech, that can make that claim. So you've not missed the boat. You're currently in the absolute ascent and acceleration of the era of aesthetic medicine. And no, it is not saturated with the correct type of person of which you will be, and you should stand out. And it's really important. I'm going to hand over to Lara, who will talk to you a bit more and get into the sort of granular components of actual aesthetic medicine and what it involves.
Thank you. I was so busy actually writing to all of your chat messages. For those that have just joined, actually, please do introduce yourselves. Priya mentioned at the beginning, but you may have missed it. So just get involved, put your questions on there. We'll get through them as and when we can, and then we'll address any outstanding questions at the end. But it's really, really lovely to see so many of you on here this evening. So toolkit, and what does this mean for you, and how are you going to apply and use this newfound passion or interest and actually get started? It's really important that for context, we take it down a notch and just understand what we mean when we talk about injectables. So fundamentally, what is cosmetic medicine, what is aesthetic medicine, and what are injectables? Injectables, and you'll all be so familiar by now with a number of very common ones. These are injectable products or devices that we introduce into the skin or under the skin for generally cosmetic rejuvenation of the face. And that can include a range of botulinum toxins, otherwise known as Botox. This is chiefly used for relaxing muscles and then reducing the appearance of lines and wrinkles in the face. Dermal fillers is another thing that many of you will be familiar with, and indeed you don't need to be a healthcare professional to be familiar with dermal fillers nowadays, but these are gels based on something called hyaluronic acid. They're temporary, but they actually are relatively, long lasting. So we've got fillers now that can last up to 2 years, and with clinical improvement in the skin and the appearance of the face in general for up to 2 years. And these are very, very safe, as are a number of other injectable products you can see listed here. What's really brilliant about the aesthetic sector now is that actually it's heavily evidence-based. So this isn't a game, this isn't experimentation, this is data-driven, evidence-backed technology that you are offering your patients in a safe way and in a responsible way as a healthcare provider. So that's great. One thing that's happened over the course of the last 5-10 years is the recent pandemic. And the general public will know this. We've become obsessed actually with skincare as really a move towards wellness and looking after oneself and one's appearance in a way that is just a lot prouder and celebratory than it was before. And alongside that, what we've seen is just this massive destigmatization of aesthetic medicine, because now it's not about vanity, it's not about wanting just to look better, it's about looking after your holistic, psychosocial, emotional, and indeed physical well-being. And there's a lot of evidence to support now that these aesthetic treatments are doing just that. So this is health provision, this is not beauty, this is about healthcare optimization. And devices is a whole new kettle of fish in itself. But if you scan across this slide, what you'll see is that there's a number of different modalities of treatment and technology that are available now to our aesthetic patients. And for you as a business owner or a clinic owner, what that means is that you can layer all of these different treatment types in one patient in a very bespoke way. It suits them, and it changes that patient from someone who would have generated you maybe £450 in revenue from a single upper face toxin treatment to somebody who is coming back to you every 2 to 3 months for 4 to 5 years, having a range of treatments, and suddenly the business generation from that patient, as you can imagine, is transformed. That patient is generating you thousands and thousands of pounds in profit every single year. And guess what? They're much, much happier for it. That's a relationship that you get to enjoy for years to come. And that's one of the really satisfying things about aesthetic medicine. We've been running training courses now for some time. Acquisition Aesthetics, has been going now very strong for well over a decade, and we've learned a lot during that process. Priya and I, with our surgical backgrounds, are obsessed with refining things, rebuilding things, and making things better all the time, and that's largely driven by the feedback that we get from our learners and, of course, our faculty. So what we have now for you is a whole world of learning in a lot of different types. It's not just about coming onto the course and getting that practical experience. We have a library of information, which includes very high level, high definition video footage, which is always accessible to you. And this library is always being replenished with new e-modules, with new webinars that are pre-recorded, with new scientific literature that we're publishing in the journals, and of course, new instructional videos. On top of that, we really do have to talk about the way in which we run courses. And it's always been with the ethos that you have to get hands-on with real patients injecting top-line product. So you're not injecting saline or water into a mannequin as you might be with a number of other, albeit reputable training providers. You're using products that you would use on yourself, on your family, on your friends, stuff that you're going to actually go out and use in your own clinical practice. You're getting confident with those sorts of products. And you're doing this in a very, very supported and supervised way by your expert trainer. Small groups, as Priya has mentioned, is really a way to catapult the pace of your learning. So yes, there's a lot of upside to one-to-one training, and we offer that as part of our Level 7 and UPP program. But actually, what you're able to learn from training in a group of similarly skilled 3 to 4 healthcare professionals is, yes, the hands-on and then stepping back, but you get to watch somebody else pick up that needle and syringe and inject in a different way. You might pick up things that they're doing that you think are better, or things that you think, oh, actually, I've got that, in a different way. And they'll have feedback from that trainer that is different to what you received. And so the learning that you take from that 4-hour practical session is transformed because you've had a time to actually step back, watch somebody else, critique them in your own mind, and then step back up to the table again and try again. Post-course support is something we're quite passionate about because when we trained, 15, 16 years ago, there just wasn't any kind of post-course support, and it was actually a little bit scary. So it's really about building a community that feels empowered to ask questions to each other as well as our faculty, and really, use and apply the skills and the confidence you've gained on a single course to further your learning, because it's all about maintaining that momentum of skill acquisition and knowledge acquisition. And we really have thought of everything over the years. And as I say, this is largely driven by the feedback we've received. We've looked at some of the barriers that have stopped people from getting started. And this will resonate with some of you because I've seen some of your messages on the thread. You've done training. Some of you have even enrolled or completed a Level 7 program. And for some reason, you're finding that there's a blocker there. And what is that? And more often than not, it's the trivial things, because we're healthcare professionals. We're not business people. We're not expert marketing professionals. And so things like where to source product and how much to buy and how am I going to transport this and how am I going to market myself to my patients? We've done our very, very best to offload all of that from you. So an example for this is Harley Supplies, which is a dedicated distribution partner built solely for graduates of acquisition aesthetics. Through us, you get access to a starter kit, it's all the bells and whistles and so much more than we could have ever hoped for when we were starting out. It's your ice packs, your gloves, your EMLA, your mirror, marking up pencil, your Clinicept, your Sharps box, your needles and syringe, and even a really beautiful case to carry it all in. On top of that, you get access to product bundles to launch your own clinic. So you don't have to think about what you need to buy and how much. We've done all of that for you based on the thousands of people we've taken through this type of training program before. So at Acquisition Aesthetics, there's a whole host of, I can't really list them because there really are countless types of courses available to you. Everything right from the basics in terms of foundation up to all of the higher level masterclasses and injectables, and also cadaveric dissection courses and anatomy masterclasses. But we took a step back about a year ago and said, if we wanted to build the perfect training program that could almost guarantee someone success in the industry in a really competitive way, what would it look like? Because yes, we have the Level 7 diploma. That's something that was government driven, but that wasn't driven and created by clinicians. Okay, that was developed on the back of an inquiry and being driven by government incentive. Okay, it wasn't necessarily born from what clinicians needed. So yes, we provide that, and a number of you have already done it or enrolled on it. But when you've got that qualification, that certificate, are you then going to be able to be successful and competitive in the industry? And we said, you know what, we think we can do better. So let's get you your accredited qualification. Let's future-proof your investment in training and in aesthetics. And then let's build you up from there. Let's upskill you. Let's give you the tools to really master lip augmentation, tear trough correction, complications, diagnosis, and management. And then let's really make sure you're relevant, because there are a number of training providers out there that do provide the bread and butter courses in terms of injectables, but you will not get access to those all important skin focused treatments that are so popular nowadays. Things like polynucleotides, exosomes, Sculptra, skin boosters, and microneedling. So we offer that as part of this pathway. And then it's really, really crucial that you're able to take all of that learning and apply a business plan to it with a really, really solid marketing strategy. So all of that is provided to you in the final stage of this program, which is the ultimate practitioner pathway. This is something that Acquisition Aesthetics owns and is very proud to own. This doesn't exist anywhere else, and actually it's trademarked, it's protected by us. If you scan a QR code that is shown there on the right, then you'll be able to access more information on that particular pathway via our website. And what does it look like for you in terms of a timeline? And this is another question we get asked time and time again. And this is fairly realistic, it's quite conservative, and it allows you to blend your existing NHS commitments. So months 1 and 2 take you through your first training courses, so typically the foundation and advanced, to get hands-on, start getting familiar with the products, with the techniques. And then there's some logistical elements to it. So you need to set up your insurance, you need to find space, and you need to think about prescribing. It might be at this point that you think about a brand, a name for a clinic, and you might incorporate a limited company as well. The following months are set with soft launch. So this is your inner circle. This is people who will give you good feedback and be kind to you, and people that you can treat in a very comfortable way. So this is friends and family, this is colleagues. And just to be clear, this isn't a route that you have to take, but it is something we've seen work for a number of people and work very well, okay? What we've said here is that this is about building confidence and not necessarily income. So this is about bringing down your price point to bring people in and crucially build up that just conveyor belt of experience and really make sure that you're feeling really solid in what you're able to do. Progressing through your level 7 during these months, and then the subsequent months 5 to 8, this is really stepping up your game. So this is pricing yourself fully. This is booking 2 to 4 patients in per clinic session and branching out. So acquiring skills in skin focused technologies, lip augmentation, tear trough correction, and just really broadening the scope of what you're able to offer these patients, such that when that patient comes through the door, it's not just dermal filler to the cheeks, it's actually an entire and bespoke treatment plan for that patient. And the final months of this particular year are dedicated to consistency, bringing back those patients, and just building up on what you're doing. And then it's really about making a decision. By this point, you'll have some security, you'll see money coming in quite regularly, and you can make a choice. You can choose, and there's no right or wrong. Of course, there's no right or wrong. You can choose to continue what you're doing in the NHS and continue what you're doing with aesthetics. You can choose to migrate over. Really, the decision is with you, and it's just a really, really exciting time, and it's a pleasure for us to be able to be a part of it with you as well. The 3 models that we've got balancing here. So the evening practitioner, and this is something that a lot of our level 7s do. So they're focused in on their NHS, they're still contracted and employed by the NHS, but they're doing 1 evening clinic usually a week. They're either renting a treatment room or they're working in an established clinic, and that will get you an additional income. So this is profit of up to £30,000 across the calendar year. For a part-time aesthetician, you're looking at blending your working days between the NHS and in aesthetics, and this might mean renting space or opening a small clinic. And you know, in our minds, this is the best of both worlds, and it's something that really works well for a lot of people that still want to wear that NHS hat. What you can earn here is up to £60,000 across a year, and this is conservative. All of our figures are conservative across this whole presentation. Model 3 is about bridging the gap. So transitioning, as we've talked about, and it's just about feeling safe in what you're doing. This doesn't have to feel scary. You don't have to give your notice in tomorrow. It's not like that. And actually, when you start training and you start speaking to faculty members that have trodden this path before you, you'll really gain a lot of confidence and feel quite empowered to make a choice that feels right for you when it feels right for you. It doesn't have to feel scary or unknown. We've done it all, okay? The need for community is so, so crucial. And actually, the subsequent part of this presentation will really shine a light on that. Aesthetics by nature is sometimes quite an isolated field to work in. If you're not connected with a group of fellow clinicians, healthcare providers, and trainers who you resonate with, who you like, who you feel safe around, then actually, the aesthetic space, much like any other space, is a difficult one to penetrate. You need a community that is going to bring you in, make you feel like family, and a group that you feel that you can grow with. And it's something that we're really proud to have fostered at Acquisition Aesthetics. That brings me on very nicely to a real live delegate and trainer experience hosted by our very own Emmeline Ashley. So without further ado, I will hand over to Emmeline.
Hi everyone, it's such a pleasure to be able to join you today all the way from the Cayman Islands, where I'm currently working as an aesthetics doctor. And it's incredible to have the opportunity to speak a little bit about my experience transitioning from the NHS to currently being completely full-time in aesthetics. And of course, specifically, I'm here to touch upon what my experience has been with acquisition. So I do have a unique perspective because I have been through the entire journey and process with acquisition. First of all, as a delegate, to completing my full level 7, to being a clinical trainer, and now being part of the core level 7 team as one of the co-heads of education. So what I used to do in this talk in the past is I would focus on quite a linear journey and progression through what I've done, but I think what's probably more helpful and more interesting to you is to go through, first of all, why acquisition? Why did I choose them? I know there's loads of training academies out there, so why specifically did I decide that acquisition was the place for me? And that's beyond talking about the process of actual training, which is excellent, and I wouldn't be speaking here for them if that weren't the case. But most importantly, I kind of want to touch upon the tangible benefits of working with acquisition for my career and also my personal as well as professional development. So, why acquisition? In a nutshell, when I first knew I was interested in aesthetic medicine as a specialty, I became completely obsessed. And it was really clear to me that I was going to take this very seriously. I wanted to be really, really good. I wanted to be safe, and I wanted to be competent. So to me, that meant absolutely no question. I am doing my level 7. I'm going to get that gold standard postgraduate training and qualification. But then who do I do it with? So there was this intense period of research that started, and I looked at everyone who was offering the diploma. Anyone who's ever met me knows I'm very type A, I'm meticulous, and when I say I spent hours researching, I really did. But acquisition stood out to me immediately, and it was for a few reasons, but the biggest part of it to me was the faculty. So I'd already identified over the previous couple of years a few really standout clinicians who I was looking up to. These were women who were just doing these really interesting things and having careers that I dreamed of. So I saw clinicians like Priya and Lara, who were surgeons in very competitive specialties who stayed within the NHS, as well as working in aesthetics and building their businesses. And I thought, oh, that's really interesting. I wasn't sure at the time whether or not I wanted to step away from the NHS completely, but I could see, okay, I don't have to. And I saw other doctors, who were working in A&E, for example, as well as running their own clinics in central London, working with skincare brands. And I thought, incredible, what a wonderful portfolio career. I saw people who were doing really interesting things, speaking at conferences, getting very involved in research and education, really advocating for things like skin of color and dermatology. And so there were these really fulfilling, nuanced, multifaceted careers that these women and men were having that was just really drawing me. And it's always a pleasure for me to see, personally female excellence, because I think representation is so important in being inspired. But it was just, excellence, full stop. So I was inspired, and I was excited in a way that had kind of been sucked out of me in medicine the preceding few years, if I'm honest. And what I noticed is that all of these people who I was admiring, who I had been gravitating towards, they were all gravitating towards the same place, and that was acquisition. So I thought, okay, there's something special happening here, and I want to be part of it. Again, I'm not going to spend too much time going through how excellent the practical and academic side of things are. You're going to get some discussion of that on other parts of this webinar. But I will say now that I'm on the other side of things, seeing behind the scenes, as it were, the amount of work and detail that goes into this diploma from a whole host of people is really impressive. And there's such a dedication to making it the best. You know, I want to acknowledge that our clinical directors are NHS surgeons who are very academic, very well known about being evidence-based in their careers. And, you know, one of the things that's so exciting and incredible about aesthetics is it is rapidly evolving, it's innovative, which is great, but also it means, you know, you have to be careful. So there are some aspects of this healthcare sector or industry, as it's sometimes referred to, that can be pseudoscientific, where you really have to be able to make a distinction between evidence-based and non-evidence-based treatments. And that's where that foundation and that learning is so, so important. So what did I get out of acquisition? I know it's just waxing lyrical about the amazing directors and faculty, but actually that connection and that community is really, really important. Mentorship is important. So personally, coming from an NHS background, I didn't have a clue of how to set up a business, how to market myself. I hated using social media, which no one believes me when I say it, but I really did. I am naturally a quiet introvert. I overthink things. Having to mold myself into a businesswoman was kind of my worst nightmare. So I needed framework, I needed support, I needed a strong foundation to get started. And the support is amazing. Again, I can tell you that firsthand. The connections I made were amazing. So it's not just mentoring, it's friendships. The very first mentoring day that I did with acquisition, I met a couple of ladies who I would now consider to be really good friends, not just in aesthetics, but personally as well. And these were women who, as we were navigating through aesthetics, you know, setting up our own businesses or working with other clinics, launching our careers, we could ask each other questions, we could bounce ideas off of each other. And, you know, they're people that whenever I'm back in London, we go for nice boozy brunches. I stay with one of them when I travel back to the UK, and they're all connections that I made through this course. And both of these friends, I have to say, it's been such a pleasure to watch their careers take off and fly. They're doing really, really different things, both doing really, really well, and they're both also acquisition graduates. So the other thing to touch upon is probably, again, and this is a very fair question to ask, okay, once I do your diploma and I get the qualification, then what? How does this translate into tangibly working in aesthetics? And I can answer that question. So there are different things you can do when you're trying to work in aesthetics, right? You can be a solo practitioner, or you can work for another clinic. And I've kind of had experience with pretty much all of the ways you can work in aesthetics. So I started solo, I started on my own. I just rented a clinic room, and I was doing this in between nonstop back-to-back NHS shifts. It was brutal. I was trying to get patients through marketing myself on social media, and it was tough. I've been there, I know what it's like when you're starting. And again, that's where the network and the support system really comes in, as well as the foundation of your practical and academic training. Because it's one thing, it's very hard to get patients in when you're starting, right? They don't know who you are, why should they come to you? But once you do get them in, you have to be good, you have to deliver results in a very competitive specialty, and you have to be able to do a thorough aesthetic consultation, create beautiful injectable treatment results. So you need to be well prepared, and you will be good if you train with us. So those patients, once you get them in, they will stay with you, they'll come back to you, and they will spread the word. Some of you might be interested in working with or for someone else in an already established clinic, which once again can be tough. A lot of clinics don't want to spend time or money training someone up. They want to hire someone who's already, ready to work, who will produce excellent work, of course. I mean, they're running a business. So I've had that experience as well. When I moved to Edinburgh a few years ago, I worked at this amazing multi-award winning clinic. They'd apparently been looking for an injector for about 6 months, and they trade tested and interviewed quite a few people. And I sent in my CV, and it was quite an intense 3-step interview process, and I did get the job. And when I was speaking to the director of the clinic, she said to me, when you sent in your CV, I saw who had trained you, and I knew it would be good. And that's a true story. I remember when I saw Priya at AUCC a couple of years ago, I thought I really need to tell her that, because that kind of feedback really speaks to itself. It speaks to the fact that acquisition has a reputation now that precedes itself, and it really does mean something when you say that you were trained by acquisition. Now, I am currently in the Caribbean on the Cayman Islands. I got headhunted to introduce medical services to a skin and laser clinic here, approached by a recruiter kind of out of the blue. And again, according to him, I beat out quite a lot of people for this job. So I'm working internationally on an island in the sun, not to rub it in, at the moment, which is wonderful. And I have the kind of career right now that maybe even 4 or 5 years ago I was dreaming of, but couldn't have even fathomed making a reality. And look, I work hard, I put a lot into my career, but I also credit acquisition with a lot of where I am now, which is why I'm so happy to be part of this incredible team. So I'm going to pass it back to them. But if you ever have any questions or want to reach out to me, please feel free.
Okie dokie. So not quite the Cayman Islands here, but Emmeline is I think actually an extraordinarily unique story. We were quite flabbergasted when she told us she was accepting that job and where her journey had taken her, but nonetheless, evidently it's completely possible. So I'm going to talk you through the live demo. So it's difficult for me to do this on a webinar in such a short period of time, but it's just to give you a really small taster. I'm not expecting you to understand fully, learn fully, appreciate what I've done in this. It's, years of experience, but if you can take a few interesting things away, or indeed your interest is ignited, then that's enough. And actually, this is just the very beginning of what it could be. So it's quite exciting. So first and foremost, it will always boil down to whether you like it or not, anatomy, always. And before, actually, we kind of heard this as a tag term thrown around. Do you know your anatomy? Have you learned your anatomy? Did you? And really, we didn't have that greater importance on it because people were just injecting a bit blind and getting away with it. Now we understand so much about facial aging, about different ethnicities and genders and the way that people age in different periods of their life and different decades, that it's all related back to the absolute core of anatomy. So I'll introduce you to my Australian twin, if you like. So Kath is my age. She's 37. I met her in Sydney a couple of years ago. She was my my model for a live demonstration, and we just mirrored each other's lives. She has 3 children. I do 2. She felt knackered, tired. Everything had been sucked out of her, a bit like me in terms of like our life post children. And she was just sort of feeling a bit lackluster and said, I just want to look and feel better. So always the first thing is to understand from the patient's perspective, and then you as a practitioner, what is bothering them, what maybe doesn't align, what does I want to look better mean to them, why do they currently not look refreshed and at their best, and how can we support and help them. There are lots of things with Kath that you can consider here, but one of the most important things that you mustn't forget to do when you're assessing any patient is assess them from all angles, whether that be the AP, so frontal view, the oblique, or indeed the true lateral. And you're looking for different things on assessment at different angles. And one of the most important things to note is this is where your sort of dental and maxillofacial component certainly comes in. It is the degree of retrognathia that she has and displays, both soft tissue and indeed bony, that really contributes to the whole feeling that she had in particular in regards to not looking at her best. So commonly she would say that photographs have this side profile of her where her chin blends into her neck, blends into her jawline, and she doesn't really feel attractive. So it's really important to elicit. Now, I can't go over assessment for you in the greatest of detail in a webinar because obviously you would have to do this. It's a day in itself, the assessment. If you can't get the facial assessment correct from an aesthetic perspective of any patient, you can't treat them. You can't even begin to know how to treat them correctly. So it all boils down to your anatomy, the knowledge of the layers, what they do, how they change, and it all boils down to assessment. Now, this is a scale that one can use, although we've personally developed on this scale, including different additional components to it, because it's a very good basic scale to use from the aesthetics perspective, looking at the skin quality, the proportions, and proportions are very interesting when you look at something like this. The line that's displayed there, touching the tip of her nose, going down to her top and bottom lip and her chin, is called Ricketts E line, and it's not aligned according to where the chin and indeed the lips should be projecting to. But proportions can be assessed in many ways, and thereafter symmetry and expression with the dynamic and static lines that a patient might display. And of course, appreciating your surface anatomy, which we all know is much of a muchness, especially as surgeons, because quite frankly, as soon as you cut beneath the skin, there is no anatomy that looks anything like this, and neither does it look like the books either. But essentially being able to understand where the anatomical landmarks would at least correspond to, and on your assessment, what you're thinking of doing, you can then develop treatment plans for patients. And what's interesting and what you can take is even just from this wheel of a very good basic assessment, these are the components from Kath in particular that are missing. So her skeletal class needs to be assessed. In addition to her retrognathia and the soft tissue component that you see, one needs to assess her occlusion. If you look closely at Kath, for a 37-year-old, and I actually compared it to myself, she's got obliteration of her nasolabial folds, and she's got a relatively hypoplastic narrow maxilla. And when you palpated her maxilla, you could really feel that. I asked Kath to open her mouth, by the by, to also assess for the roof and the arch of the palate, and she had an extraordinarily high arch palate, which would come hand in hand with the narrow maxilla that she had and the obliteration of the nasolabial folds, because now different things that I've learned from the NHS were going off in my mind. She has a relatively hypoplastic, underdeveloped maxilla, and one needs to ask oneself why. Interestingly, when you look at her from the lateral component, I don't know if you can see my arrow, probably not, but you come down from the globe of the eye and protrusion and you look at the anteromedial aspect of the cheek and then coming down, one needs to appreciate the vector that you see. So you are comparing the angle from the protrusion of the eye or the orbit and the infraorbital rim to the projection of the cheek. And actually, as you would expect, the cheek should project further than the eye does. But interestingly, in many patients, it doesn't. And what that gives is a perception of tiredness and also gauntness and too thin, which actually is perceived as a negative characteristic. So she had a negative vector that was very interesting. And so what we do is we develop a treatment plan for her after appropriate assessment, assumption of anatomy and knowledge of anatomy. And the treatment plan is as follows in terms of the steps. So Kath is now going to be treated by me in every stage from top to bottom. And this is only with HA fillers, of which you'll hear terribly bad reputations, but that's because they're injected incorrectly. But HA fillers have remarkable outcomes if done correctly. This isn't introducing the component of neuromodulator for wrinkle relaxing, skin boosters for her skin quality, sculptural biostimulators for the tightness of the skin, lasers for the pigmentation, and topical skincare for her to use at home. So where you now go with your aesthetics portfolio, and in terms of what you offer patients, even microneedling every 6 weeks, exosome treatment is vast. So now it's not just your Botox and fillers, it's actually far greater than that. And you'd be wise to understand how you can utilize the entire portfolio. But here's what we do in regards to just utilizing a treatment plan with HA fillers. And moving on, we begin. So first of all, after you've done your assessment, you must mark your patient. You must mark them sat up and in static and dynamic movement, because they need to smile and move and speak to you. Because once you place the filler, it's all great. But when they start moving and they become animated, suddenly the filler moves bizarrely because you didn't account for the fact that they would become more animated. So it's important you do your markings up. And these markings are taught on our courses, but also individually, you learn these from the various practitioners. Once marked up, I begin one of my treatment steps that you saw with the midface. Now, the midface is predominantly reconstitution of the presumed bony resorption she's got. as we age, we all have bony resorption, different areas resorb differently. And actually, I know that down to the bone, injecting a high G prime HA filler will give her a degree of skeletal restructuring before I even start with the layers above. Now, remember, very broadly speaking, but again, I'm not a massive fan of this surgically, but non-surgically, the face has got 5 layers, and I'm currently reconstructing this layer down here. I haven't even begun reconstructing the higher up layers, and that would require different products. I'm using a needle with a high G prime product. The rheology is such that it will lift and restructure on the bone. And I'm using that down with a needle because the needle gives me the feedback on the bone that I need. So that's one product choice for one specific area to reconstruct. I then reassess her after I've done that injection. I sit her up, I ask her to smile, I see how her tissue's moving. I don't expect any great change because I'm reconstructing these 5 layers very slowly, bit by bit by bit. I then ask her to smile, look for a reflection of light, which now I know is the soft tissue fat compartments, often superficial to the SMAS layer, whereby they give us the curvature and contour of the light reflection that we desire, and I need to now augment that. So I highlight that, I draw it up with her sat up in animation and still, and then I look to augment it. Now, augmenting this area is completely different. It's the same area visually, but I'm more superficial. So now I need to use a product that I know won't fix and hold to the bone, a product that will move with her as she moves and becomes a bit more dynamic as she becomes dynamic. And the product is placed using a longer blunt-ended tube called a cannula. Why? Because the cannula can feed into the layer that I know I need to get in, and I can feel that feedback on my hands, whereas if I use a needle, it would just pierce through everything and I can't feel anything on my hands. But as I do this, I know exactly the layer I'm in of the 5 layers I demonstrated to you, and in the marked area, I deposit linear retrograde threads, so linear straight, retrograde backwards threads of product, of a different type of product, that she will smile and it will remain integrated into her tissues and smile with her. So again, my little finger here is actually blocking the nasolabial fat pad because you don't want to put any product there, because as we age, the nasolabial fat pad gets larger. So adding product volume to this area is actually really counterproductive. So there's little
just to explain what we've done. Down to periosteum using Restylane lift, coming quite medially as I showed you. We've done then over the superficial and deep fat pads, done that reflection of light when she smiles with Restylane volume, down to bone with Restylane lift. And then we've done eye light medially. It was massively corrected by her upper cheek rejuvenation and restoration. And so actually we only had to put 0.2 in, and I thought it would be a lot more of Restylane Classic in the tear trough, and then the palpebromalar groove takes less than 0.05. So 3 small injections just to correct that, accompanied by a smaller bruise here.
So now when we move on, you can see that we've only treated some areas and we're now working to step 2 and 3 of the treatment plan. We're looking at treating the lower face and indeed the lips, again demonstrating the anatomy. So for the lips in particular, I don't treat the commissures. We don't want to splay the commissures as I show you here with any degree of filler. The oral commissures are set to come together really nicely, and therefore treating them is counterproductive. I treat the border of Cupid's bow only. That's the only thing on the borders that I treat. I never treat the vermilion border anymore. But Cupid's bow is treated from the apex of Cupid's bow just over the midline with a linear retrograde thread, and you see the product even deposited at the skin surface. So it shows you exactly how much I'm depositing, which is really, really minimal. As we progress as well now, look, there are lots of ways of treating the lips, loads of different ways. And actually there's boluses, there's respecting the tubercles, there's linear retrograde threads, there's lollipop techniques, superficial, deep, etc. But if you don't understand your anatomy for this area and where the vessels are predominantly lying, which is often behind the muscle and submucosally, then you can't get the best outcome for the patient. So here I deposit this linear retrograde thread with a small amount of product at the tip there. We leave that, and then we go to do the contralateral side as well, just for redefining the apex of the Cupid's bow. You see how superficial I am there. A, because the patient's in pain, the nerves are lying there. B, because the tissue blanches but recovers. I'm sort of intradermal, okay? And you've got to use a needle to get intradermal. And then you can also see minimal bruising because actually there's minimal insult to any important vessels. You can see the reflection of light is enhanced, as you can see there almost immediately, and the degree of sort of swelling then ensues, but it all calms down after about 2 to 3 days. So we're then looking to subsequently augment the body of the lip. We do this with superficial deposition boluses, linear retrograde threads here with some deposits of product at the tip of the lip. Sometimes I have it, sometimes I don't. It doesn't matter. I never get migration. I never get problems. I've done this for 14 years. And we subsequently do linear retrograde threads along the lip very superficially. Many terms given to this technique, vectoring, tenting, whatever you might want to call it. And then as we approach the commissules or the end of the upper and the lower lip at the point where they join, I stop injecting and I don't do any more injections on that side. So when we look at her, interestingly, because it's always really important to look at someone in real time and not just from photographs, you can see these are the changes that one is hoping to achieve, okay? Her cheek is now coming out further to give her a happier appearance. Her chin is further projected. We've also done the lower face and indeed the chin. There's further harmonization and alignment of the patient. And when you look at all the areas that we've treated, and you look at her before and after, and actually this is only 48 hours after because I did it over 2 days, and I've returned to Australia for my Australia tour 4 times, and I've touched base with Kath every single time that we've gone, and she says that she doesn't see anyone else, which I think is ridiculous because I only come once a year, but the results that she obtained from this in particular are as you see here. So you've seen her from her front on. She looked happier, brighter. We did temples, tear trough, cheek reconstruction, mid-face reconstruction, nothing in the piriform fossa and nasolabials because they were obliterated, lips redefined, chin projected in 3 layers. So again, bony work down to the mandible and then superficial work as well. And what's really interesting is that I actually didn't touch her gonial angle, but you can see the power here of illusions. I didn't touch her jawline, but the power of illusion when you realign somebody and you project them is really, really quite remarkable. And she just looked brighter, and she was far happier immediately, and that had a huge impact for her. So I'm going to hand it back over to Lara, who's just going to summarize what you've learned tonight and then wrap up, tell me I'm over time and tell me off. And then she's going to talk a little bit about any questions that you might have, and we'll answer them.
Great, thank you, P. And what a beautiful result. And I think listening to Priya and the way she talks about her relationship with this particular patient, it's really testament to the relationships that you can build and the satisfaction that you can gain from doing this. If you like people, that's what it comes down to. If you like people, if you have a creative energy, if you have a little bit of an entrepreneurial appetite or spirit, then you're in the right place. You've come onto the right webinar tonight. And there's a lot that can be done in the world of aesthetics for you. So moving on, because we are over time, and I do need to take you on to just next steps, really. I've talked to you about the Ultimate Practitioner Pathway. That is a fully comprehensive, unparalleled program of learning to take you from wherever you're at currently in aesthetics or not, to someone who is really quite dangerous to other clinicians, not to patients, obviously. And actually, if you were to price up all of those individual courses, because there are lots of different learning bits and pieces that come with the Ultimate Practitioner Pathway, the value of that at RRP is over £16,000. As a standard bundle, we offer it for just under £14,000, but as a special price for all of you guys tonight, because you've joined us on this webinar, you've given us your time and your trust, we have a special discount which takes it to £12,500 for all of this learning that we talked about, the foundation and advanced courses, of course the accredited level 7 diploma, all of the master classes, all of the cosmetology courses and the business and marketing support and masterclass. So if you want to continue the conversation, please book a call with one of our very many dedicated brand ambassadors, some of whom are listed here. They'll talk you through next steps. They'll try and build something that's bespoke to you. They can talk to you about payment plans, training options, training locations, and any other questions that you might have. So without further ado, I guess we'll open the floor for any other outstanding questions. I know the team's been very busy on the chat going through anything that's been coming up.
I'll start with a clinical one, but if that's okay, in regards to the chin, I'll come back to this page in a minute. So in terms of the chin, so hard to teach in such a short amount of time. So the chin was reconstructed, just out of question, using 3 different types of products. So the chin was reconstructed along the mandible, and indeed sort of at the symphysis and laterally from it, from the midline. It was mainly small deposition boluses of a high G prime product. Then you have the mentalis muscle, which for her was overactive. I didn't tox it. That's a different discussion for a different time, but it's wedged and sandwiched by 2 fat pads, we now know. And so both superficially and deep, she was augmented, coming in from the mandibular ligament, augmented with a cannula to soften her labiomental crease and indeed the loss of volume here. So main projection was achieved through high G prime products, coming front-on projection and inferior projection, and then overlying it with soft tissue work using cannula works, using 2 different products to allow for further projection. It's a kind of synergistic effect, right? And not many academies teach that, because I actually believe you probably need to understand your anatomy having lifted up the face, which we do as surgeons, but it's a synergistic component for all 5 layers that added to bit by bit by bit to give that degree of projection. And by the way, she was a 9 mil challenge. So she's got 4.5 mils, and I did it in 4.1, but anyway, about 8 mils in her whole face, which is nothing. So she's got 4 mils per side, which for her is very little. But it was the synergistic use. Right, but your question.
Emily Waters has come on and asked if the UPP is best for those with no prior experience. The truth is the UPP was developed with everybody in mind, including people that have no prior experience. And I mean absolutely no prior experience in aesthetics. It's so important that actually at the very, very beginning, you take your time to choose a training provider and a network of people that you connect with and that you think that you could feel supported by. Because if you're going to get to where you truly aspire to be, it's going to take time. It's not just a single course, it's a process that takes, some doing. It takes years, 1 to 2 years really minimum of dedicated training. So that choice is so, so important. And as I say, the content, all the bits and pieces of the UPP were put there with you in mind. If you're a healthcare professional, but no prior experience with injectables whatsoever, then the UPP is exactly for you. And what I will say is that, yes, there's the option to book sort of standalone courses. You're busy and we're all busy. Momentum is really important. You need a group and, a team of like-minded delegates that is going to push you, that is going to be on your back about getting onto that next mentoring session. It's going to chase you for any coursework or completing your e-learning. It needs to be a group that is going to drive you and get you excited about the next steps. That's how you build momentum, and that's how you make sure that you get to where you want to be. My answer is yes, Emily.
Yeah, I was like, why don't you just say yes? It's designed for beginners for sure. It's the foundation advance you'll start with, and then it's the support, guys. It's not possible now. It wasn't possible then, we just didn't know it. It's not possible without a community, and a supportive one at that. That's what you need it for. Okay, someone said last couple of questions. We'll take one more after this, and that we'll have to call it a day. How long is the course? Well, it depends what you're doing. But if you're doing the UPP or the level 7, which is generally all that we have people really that recommended to do, it varies. It's at your pace. It's designed to work around you. So you might have nights, days, family, sickness, bereavements, whatever you might have, the whole thing keeps going and works around you. The shortest we've definitely had it completed, which is nothing shy of a miracle, is probably within the year, which is pretty phenomenal. Even 8 months for the level 7. I think that's unheard. But she left the NHS and went full-time into this and has done very well since. But otherwise, on average, it takes people between 1.5 to 3 years, because they want to continue moving with us and the community that they have. They don't look at it as a finish line, they just look at it as ongoing learning that's continuous, and that's the best way to look at it for sure. But that gives you an idea of timings. And then days and weekends, yeah, Violetta's answered. It was weekends mainly. Our sculptures, skin boosters, generally weekdays, but they can be weekends. But the 90% of our courses are at weekends to offer flexibility. And our 2026 dates, with the exception of New Year's and Christmas, we are running courses every weekend. So that's how many we run, a phenomenal amount, and some during the weeks as well. So predominantly weekends. Okay, I'll shut it, Lara, otherwise we'll keep going. Hopefully it was useful to everyone, and thank you for all joining. It's tough on a weekday, and we can talk for hours and teach for hours on this, so we appreciate your patience, and your interactivity has been one of the best, so well done and thank you.
Thanks everyone for joining. Have a good evening.
Bye, have a great evening.